Hey everybody, it's Dr. Wood, and today we're going to be covering Chapter 22, where we talk about some skin disorders. And so, some common reasons why patients might show up to, say, the urgent care or the ER for skin disorders include things like pruritus or itching, hives, inflammation, a lot of discomfort, erythema, especially in Florida. You might see a lot of sunburns and things like that showing up. And so it's important to know what the common side effects from a lot of medications include, things like burning, pruritus, a lot of the things that they may have been showing up for in the first place. So it's just important to understand that based on the medication you're using, what are some of the effects you might see there. Just like certain things, especially in Florida, certain drugs can cause photophobia or photosensitivity, where basically you can actually find sunburns that can be worsened just by the medications themselves sort of sensitizing the skin to the UV rays. And so what is the function of our skin normally? Well, mainly it's used to protect a lot of the deeper tissues. It helps to regulate our body temperature by either sweating or not. It can excrete minerals and water through the act of sweating, and also be used as a site to absorb a lot of substances. We're going to focus today more on medications that are being used for topical purposes rather than systemic purposes, but some of them can be given via patches that do get absorbed into the system that way. And so when you're looking at dermatologic preparations, there are many that are available there. And so a lot of times you have to pick it based off the effect that you're looking for. So for instance, you may have really dry, scaly skin that you might want to use something that's more moisturizing, or the skin may be really wet and sort of weeping, which may want to use something that will dry it out. It's important to know that the skin should be clean and dry for the most part for optimal absorption and effect of the drug. And just to look at a few things that directly affect the absorption can include the form of the drug, whether it's an ointment or a cream, the size of the molecule. Usually smaller things get through a little bit easier. The base, or as I mentioned, sort of that form that the drug is in. And then things like hydration can affect this. Usually better hydrated skin will allow for better drug absorption. And then usually if you talk about things like things being occlusive, things like dressings can actually increase the occlusiveness of a drug and increase its absorption. So anytime you wrap something around a topical product, that typically increases the absorption. And then a really important factor is the thickness of the skin that you're applying the drug to. Typically areas with thinner skin will absorb things better, which may lead to better therapeutic effects, but it can also lead to side effects. So for instance, places like the face, the genitalia, the axilla, places like that tend to be a lot thinner and absorb drugs better than places like, say, the abdomen or, say, your feet or your hands or something like that. So different types of preparations. You can have things like baths and soaps, which are meant to be sort of cleansing. You can have things like emollients that are good for sort of hydrating the skin or softening irritated skin. Lotions tend to be things for insoluble powders or drugs that are put into suspension. That can be useful for certain lotions. And then things like liniments and rubs are typically good for like things like sore muscles. They tend to produce a lot of external heat. So these are things like camphor and menthol, things like Bengay or icy hot, things like that tend to be liniments and rubs. Now, things that may be used daily, a lot of these are over the counter, include things like disinfectants and baths and whatnot. Typically, you're going to find that a lot of the soap products tend to be pretty drying to the skin, mainly because they do disperse lipids, and they will get rid of any kind of natural oils on the skin, which tend to dry it out. These can be ameliorated by putting things like skin protectants on, which will help to sort of protect the skin and keep it nice and moist. This is good especially for things like pressure ulcers and ostomies to actually prevent further damage to those tissues there. And then, as I mentioned, you'll find that rubs and liniments are good for producing heat. You actually don't want to apply external heat on top of that, because that can actually lead to risk for burning of the skin. Now, there's a lot of different bugs that grow on you all the time, and depending where you're at, you may see different types of bacteria, but you do see a lot of gram-positives. This can include things like Streptococcus pyogenes, and along with Staph aureus. And so you'll find these to be the most common ones that cause things like skin infections, like impetigo, furuncles, or carbuncles. And then what we're really seeing nowadays is that community-acquired MRSA, or methicillin-resistant Staph aureus, is becoming more common, meaning that we're having to use maybe more intensive medications in order to treat this, which is becoming a problem. Now, here's some common antibiotic topical agents you're going to be using here. So for instance, things like mupirocin, it's called Bactroban. This is actually applied around the nares, and that is good for helping to decrease the carriage of MRSA. So we'll do this a lot for patients who are coming into the hospital that we don't want them to spread MRSA to other patients. I'm sure many of you use things like bacitracin ointment, which is good to apply to cuts and abrasions and things like that. You may actually find this used in what we call a triple antibiotic ointment that typically includes things like bacitracin, polymyxin B, and neomycin. These are very common things you'll see used for first aid preparations. Now, other things we can see include things like antiviral agents. These are typically applied to things like herpes lesions. It's important to make sure that if you're applying it to someone else, you want to use gloves and protective equipment to prevent spread of that infection there. And you'll certainly see different varieties here include things like ointments, solutions, gels, and creams. Now, in terms of topical corticosteroids, this is a really common set of topical medications we might be administering here for things like insect bites and dermatitis. Over-the-counter hydrocortisone is used very commonly, but we certainly have things that are much more stronger than that. Things like clobetasone and things like that are used for psoriasis and eczema and whatnot. Keep in mind that things like gels are better for hairy areas of the skin, but they tend to irritate the mucous membranes. The skin is really dry. This is where things like ointments can come into play, and they're nice because they help to hydrate the skin a little bit better there. Now, when you hear the term vehicle being applied to a dermatologic preparation, that basically means that what is the drug actually being put in, and that could be the lotion, the cream, the ointment, whatever it happens to be. And again, it may either be an emollient, things that hydrate the skin, or it could be a drying agent depending on the drug that you're dealing with there. As I mentioned, that absorption tends to be higher with thin skin, poor with thick skin, depending on where you're putting it. And actually, you can see more side effects, systemically speaking, if you apply, say, for instance, a very high potency steroid onto the face, because that's a lot thinner skin than elsewhere in the body that it can absorb it much better. Just note as well that glucocorticosteroids, things like hydrocortisone, other things like that, tend to cause atrophy of the dermis with prolonged use, so we try to limit how long patients are using this. In terms of topical antifungal medications, fungal complaints fungal infections are a common reason why people will present. And so you can find that they can present on the feet, the axilla, perineal areas, under the breast. Most of the time, these tend to be things like tinea infections or candida. And so we have a lot of powders and ointments and things like that can be useful for treating those. And oftentimes, to deal with the inflammation, itching, and the uncomfortable sensations, we'll actually give this along with corticosteroids to help decrease that inflammation. Now, another very common reason to get dermatologic medications includes things like acne, which has probably affected most adolescents and young adults. And so we typically see this is caused by increased sebum production, which is a type of lipid that will clog up hair follicles, and that leads it to have this nice anaerobic environment where certain bacteria tend to proliferate. And you can find that depending on where the patient presents with acne, it can be on the face, the chest, the back of the neck, and can present as papules, pustules, or comedones. And so you'll find that a lot of over-the-counter products for acne tend to include things like benzoyl peroxide. And so by the time patients come to see you, most of the time they've already have tried that and they want to get something else. Note here as well that a lot of the medications do cause skin irritation in and of themselves, followed by a lot of peeling. So depending on the agent, you may want to use a lower strength. You may want to make sure patients are using this along with some sort of emollient or some sort of moisturizer. That will help to deal with a lot of the irritation. Here are a variety of different agents you can use for acne, including things like benzoyl peroxide, as I mentioned, but certainly there are certain antibiotics you can use, things like clindamycin. Certain oral antibiotics you can use include things like doxycycline, minocycline, a lot of different varieties here. Now, what's interesting is you also use what they call retinoids, are going to be agents that are sort of varieties of vitamin A in order to treat acne. They tend to have a very strong sort of chemolytic effect. They'll actually help to cause sort of change in sebum production and things like that to help get rid of those little tiny infections there. And so this can include things like retin A. Retin A itself is actually also used for things like hypopigmentation. They can be used for wrinkles, things like adapalene, azelaic acid, things like that. However, really difficult to treat cases of acne, some patients may actually go on what they call isotretinoin, or Accutane is another name for this. And so this is actually an oral retinoid agent that's really important because it's an agent that can cause severe teratogenic effects, meaning it can basically cause severe birth defects, or it can cause fetal demise entirely. And so isotretinoin actually has a whole program associated with it where the provider has to be registered with it, the patient, and actually the pharmacy as well has to be registered with it to make sure that patients actually don't get pregnant while they're on the medication and unintentionally expose a fetus to that, because it can be so dangerous. And in fact, they actually have guys sign up for it as well, because actually while they're taking it, their semen may actually be laced with someone that could affect the female patient. So they make sure they get frequent pregnancy tests, and make sure they have oral contraceptives potentially, or make sure they're educated on using prophylaxis to prevent pregnancy. So it's really kind of an interesting way to prevent that really severe consequence of the drug use. Now, you may find that because these agents are irritating, you want to really keep them away from places like the eyes and the mouth and other mucous membranes, and really expect a lot of skin drying and peeling, which is why we make sure they use some sort of emollient or some sort of hydrating substance along with it after they apply the drugs themselves. Typically, you're going to find that it's better if you use water-based cosmetics. They tend not to clog the pores quite so much. That can help deal with acne as well. And again, as I mentioned, don't use any vitamin A preparations like tretinoin along with pregnancy. Now, it's important that you remove any cosmetics before applying the acne product, because they will interfere with it and prevent the drug from working itself. And we'll typically try to wash and dry the skin maybe 30 minutes before applying things like tretinoin. A lot of those retinoids tend to cause a lot of severe photosensitization, so patients tend to be more susceptible to sunburn, so we really make sure they wear high SPF sunscreen along with that. Okay? You may need up to 6 months of treatment before you really see full effects out of those drugs there, right? And then keep aware of any topical tetracyclines. They can actually turn the skin yellow, or they can stain other fabrics. That would be one thing to note with that drug as well. Now, there's another group of drugs called keratolytic agents, and these actually help to promote shedding of the top layer of skin there. And so these are good for things like acne and warts and corns and things like that. And actually what's really helpful with this is if you soak the area first in, say, warm water for 5 minutes, helps to hydrate the skin and helps the keratolytic work actually even better. And so different agents here include things like salicylic acid and sulfur-based products are actually really good for those purposes. Here's a list of different ones you may actually run into. A lot of these tend to be over-the-counter products that patients may try firsthand before going into a provider to get something more prescription-based, like salicylic acid is found in a lot of wart-based products. You may try this first before they end up going with something like imiquimod or Aldera. They can be prescribed by the provider, and they can go pick that up and tend to be a little bit stronger. Now, we also have topical anesthetics and antipyretics. They typically are useful for helping out with itching of the skin and can include things like benzocaine and lidocaine. Also, things like calamine lotions and oatmeal baths tend to be pretty helpful for this as well. You find things like Benadryl ointments and lotions and whatnot tend to be very helpful for itching and pruritus due to inflammation. Here's a list of different agents you may also find as well. Lidocaine is a very common one we'll use typically for things like IV sticks. We'll actually apply this to the skin over a vein prior to getting an IV stick, and that helps to numb it up, help deal with pain. Other things include things like calamine lotion, oatmeal products, other things like that help with a lot of itching and inflammation. Now, if you're treating burns and chronic wounds, a lot of that is going to be dependent on the burn type, the depth, and whatnot. Keep in mind, though, that open wounds tend to absorb drugs better than non-open wounds, and so that's another important thing to consider there. But common products will administer to things like burns include things like Silvadene, things like that can help with the healing and make it a little bit faster. They also help to prevent infection, which is another common complication of a lot of those burns and wounds. Now, certain prophylactic agents we may administer prior to any kind of skin injury has occurred here, and this includes a lot of skin protectants and sunscreens. It's important that skin protections help to prevent maceration and help kind of maintain some degree of dryness with the skin, and so this is like really helpful for things like diaper rash, which tend to cause a very moist environment that helps for things like Candida to grow, and so you'll see things with zinc oxide tend to be very good for this. In terms of sunscreens, they typically are measured by SPF, which is basically the amount of time that patients are going to be protected against UVB rays. And so higher SPF tends to denote better protection, right? So an SPF 100 will protect a lot better than like an SPF 30. Sunscreens may also contain some sort of chemical protectant, including things like avobenzone, which helps against UVA rays. And just note, obviously, sunburns are going to occur when the sun is shining most, usually between 10 and 3 p.m. We have some other medications that can be used for some insect sort of infections or infestations, things like scabies. You may find things like blisters around the fingers, around the wrists and elbows tend to be a common sign and symptom of that. Typically, we'll apply things like lindane lotion to the entire body, and that tends to be very effective for helping to kill off those little parasites, typically leaving off around 8 hours at a time. And typically, you want to make sure you treat any kind of bed linens or clothing the patient has at the same time, because otherwise you may find that the linens are going to be contaminated. You treat the patient, but then they get back into bed and get reinfected. For lice or pediculosis, you're going to find this is can either present in places like the hair, on the head, or the pubic hair, things like that. Typically, we're going to be applying things like lotions and creams in order to help treat that. One really important thing here as well is that you have to comb out the eggs or the nits. They can actually embed themselves in the hair shaft. So you have certain things like nit combs and things like that that can help get rid of those. Otherwise, you can kill the actual bugs themselves, but then the eggs will hatch later on. They tend to be not affected as well by the drugs. Again, another thing, we want to treat all the clothing and bedding and whatnot. This is really important to make sure you don't repeat use of this drug too frequently, because that can actually lead to things like seizures in kids. Here's an example of a few things like lindane lotion or promethazine, which is known as Nix, or malathion. This is actually sometimes used as an insecticide for things like crops and things like that. We're using a much lower concentration that are used directly on the head. Other things to note here as well, make sure that the treatments are not going to be given to the face unless it is specifically recommended by an expert there, and make sure you avoid any sort of touching of this if you're not the patient, because you want to avoid any sort of side effects potentially. So wear gloves, and make sure you're treating any sort of household or sexual contacts concurrently, because it may also be infected with it. A lot of these products tend to contain things like alcohol, and so you want to keep it away from any open flames, smoking, hair dryers, because that can potentially ignite. So that's it for this section. If you have any questions, let me know, and I'll talk to you soon. Thanks a lot. Bye.